Thanks for having me here. So I'm Kenton O'Hara. I'm a fairly recently appointed Professor of Human-Computer Interaction in computer science. And my interests are in sort of human-AI interaction, computer-supported collaborative work, which is looking at the ways that technology enables teams to work together, and also interested in human-centered design. So how can we use understanding of the human context and the ways that people work to inform the design of new technologies, including AI. So the specific question I'm interested in is really within the context of healthcare is how do we design these AI systems such that we can make them meaningfully actionable in the everyday collaborative care practices of clinical care teams. So going back to the earlier talk about clinical pathways and the practicalities of how teams work together, how do we situate the outputs from machine learning models within those such that they can be meaningfully used to improve patient outcomes, importantly reduce clinician workload, and also make care practices more efficient and effective in terms of the resource allocation to particular patients. So how do we do that? We do social studies of clinical practice, so we go into hospitals, speak to clinicians and so on and so forth, do observations of team practices to understand the kind of decision making that they do both as individuals and collectively within teams, and use that to define things like actionable questions that can be useful and addressable by machine learning model development. We also think about the sort of machine learning not just as a data problem, but also thinking about it as the user experience of the system. How do you present that information to clinicians and nurses and clinical teams such that they can be interpreted and make sense of in the context of their work? And then there's the question about what can be automated and what needs to be sort of have more human oversight, and that's kind of dependent on the performance of the models as to when we need interventions. So I'm just going to give you a quick example here about how do we predict patient deterioration across the surgical journey. So can we use machine learning, can we use EHR data and machine learning to provide early insight of post-operative risks? So we informed the machine learning development through observations and interviews with clinical teams, and that's kind of highlighted the challenges of uncertain risk predictions. How do you do direct clinical interventions on the basis of uncertainty? But what you can do is actually use these risk models to maybe inform risk mitigation behaviour in particular contexts of care transitions. So can you, for example, use that to say, do more frequent monitoring of patients? Can you do more proactive ordering of drugs and so on to do risk mitigation strategies on the basis of these risk predictions? I think it's also important to think about the different metrics that we have. So here we have sort of machine learning performance models, but how do we translate that into human terms by translating those into things like what are the numbers of enhanced protocols that we need based on things like true positives versus false positives, and then also how do we think about decision making in the context of patient groups as a whole rather than just individual risk models.